Okay, today we're going to talk about baby crying. Now, most parents, when they think of baby crying, they are fully aware that they're going to be coming in for a lot of grief with their child's crying when they're in the first few months. But many parents will say to me they really had no idea that it was going to be as bad as it is. They get taken by surprise, especially first-time parents, and they can sometimes become quite overwhelmed with it. They may ask themselves, is there something wrong with my baby, or perhaps there's something wrong with me? Am I doing something wrong that's making my baby cry so much? As a consequence of this behaviour from babies, we can often start thinking that there might be something wrong, and so people have labelled crying babies with having medical problems, such as having something wrong with their gut. The word colic is probably going out of favour now among paediatricians, in that the word does really imply that there is something to do with their colon, but really most of the time it is just normal infant behaviour. So what is normal infant crying? Well, there's a very useful acronym called PURPLE crying that was developed by some paediatricians in Canada and the United States, where the word PURPLE is an acronym for all the different aspects of what is considered normal infant crying. So the first P is for the period of crying, that it usually peaks at around 2 months, and it can last up to 3 or 4 or even 5 months sometimes. That it's unexpected. They seem to cry out of the blue for no particular reason. That the crying seems to resist any soothing attempts. That's the R. And then the second P is that it has a pain-like quality about it. It seems like they're in distress, which of course parents find very, very distressing. The L stands for long-lasting. The crying can often last up to 5 hours over a 24-hour period or longer. And the E is that the crying often has an evening cluster. So these are all the normal characteristics of normal infant crying. However, of course, there can be a medical problem that can cause a baby to cry, and if you are worried, it's quite reasonable and appropriate that you go and have a chat with your doctor and make sure that there is nothing else going on. The other aspect with crying is what you do when it happens. Of course, we like to be able to respond to our baby's crying calmly, but that can be very difficult. Doing walk and talk responses where you're trying to soothe your baby, of course, is a good idea, but it doesn't always work. And if you are stressed out, if it is really bothering you, being able to step away, being able to walk away when you're worried about the way you might respond is something that you really should do if you feel you need to. And of course there's a very important message, and that is to never ever shake your baby when they're crying, because obviously it's a critically dangerous thing to do. So if you think your baby is crying a lot, get help. If you're not coping, get help, because it is hard when your baby's crying, but it's one of those challenges of parenthood.